Okay, this is a question that we get a lot, and that is, what about exercise? What's the deal with exercise? So let me ask you this. Should you exercise after surgery? Yeah, okay. Do you think you're gonna? Let me ask you a different way. Do you think my patients are out there exercising?
I'm hoping it'll make things easier again. Because I did, before I got fat, I did like to exercise.
Let me ask you a different way then. Do you think most people are exercising this morning have been, if I were to go and find all of my ex-patients, how many of them were at the gym this morning? What percent? Okay, so we could give them a big benefit of the doubt and say 10%, but that means 90% of my patients did not go to the gym this morning, including me.
Yeah.
All right. Yet, they all lost weight, didn't they? And you've talked to them, they've lost not just a little bit of weight, massive weight loss.
Yeah.
Yet, we're saying, I bet you, it is more than 90% are not exercising. Now, should they exercise? Yes.
Yeah.
Are they bad, nasty, weak, terrible people because they didn't exercise? No, they're more like average people, right? So we could, if we wanted to blame them. Let's suppose somebody comes back to me and hasn't done as well as they wanted to. I could use this as a defense, and I could say, you didn't go to the gym every morning. You're a bad patient. That would get me off the hook, wouldn't it? But it doesn't realize what the reality of American and Canadian society is, which is most of us have lives, right? Like we get up and go to work, we have families and responsibilities. I can't give an hour or two at the gym and getting dressed to go into the gym or going running or going hiking every morning. I don't have that kind of time. I wish I did. Maybe I'll increase the price of surgery so I can take a couple more days off and just exercise. We think of that idea.
Do that next week.
Next week.
Or hips, man.
Right, that's the beauty of it.
That's true.
Well, we could increase it compared to what other people charge OHIP, but think about that for a second. So we want to tell you, first of all, should you exercise? Is it good for you? Yeah. Are most people exercising? I don't think so. Should you exercise? Sure. But if most people aren't, isn't that kind of we have to be careful on how we say it. Should you exercise? Yes. Should you exercise every day? Yes. I want you to exercise, but I believe that I know the reality of American and Canadian society is that most of us are not exercising. Now, should you exercise? Let me say it one more time. Should you exercise? Yes. If you don't, are you still going to lose weight with the MGB? You betcha. That, yes.
So I just wanted, I think people, a lot of people that I've talked to, and online and whatever, I think a lot of people are exercising, not necessarily going to the gym, but a lot of people are exercising and they don't know they're exercising. Mm-hmm. Because there's something about the MGB that makes people travel. I have seen more pictures of, here we're on our cruise, here we're in Hawaii, here we're, climbing the Alps, here we're doing this, here we're doing that. I think people don't necessarily go to the gym, but they're out shopping, they're out, they're walking the mall where, right. There's pictures of people at Disney World.
So could I say it this way? Our patients after MGB are definitely more active.
Active. And
more
active is exercise. And
yeah, and I think you get credit for that, but that's a little different. I think being more active is good, and I want you to exercise. That's why I want to emphasize that. I want you to do that. But how much exercise does it take to lose weight?
A lot.
Anybody tried it? In other words, tried to lose weight by exercise? By going to the gym for an hour a day? Have you tried it? Okay. With a trainer? Have you tried it with a trainer? Okay. How successful was it? Yeah. Why?
Pretty much yo-yo.
Well, what we found and what I think the research shows is the amount of exercise you need to lose weight is 4 to 5 hours a day. Okay? So in other words, first of all, should you exercise? Should you be more active? Yes. Do you want to exercise enough so that you lose weight? Yeah, you can do that. Go out for the Olympic rowing team. That'll do it. In other words, my daughter played collegiate field hockey at Columbia University. Okay? All right? She had 2-a-day practices for a little over 2 hours twice a day. You do that, you're going to lose weight. Okay? You got that? Anybody got that kind of time? No, we don't have. Now if
I was just going to say, when my partner comes in town every couple of weeks, he makes me go to the gym with him at 4, and we get on the bike with the monitor, and I burn in about 40 minutes, I'll try to get that 30 calories burned.
Mhm.
Well, that's, or not 30, 300.
Right.
Okay? Well, when you figure out 300 calories, I'm doing the math in my head, and I'm thinking,
It's a quarter of a hamburger.
what did I really do for myself today? And I just burned, worked really hard this morning, but I don't think I didn't.
That's a piece of toast.
That's right.
I'm like, dang, that didn't get me very far.
That's
so.
right. That's right.
But
That 40.
I also have a son that's races at a national at a national level, and this kid's fit. But he's probably already put 40 miles on this morning on a bicycle, and then later this afternoon he's at the gym, and this kid can get fit. But I guess my question is okay, do the surgery. What's the exercise, if I exercise, and I will, I think, because I'll be smaller, or at least I'll get there, because I like exercising. What's that going to do for me? Because you said it wasn't gonna be good for you.
It is. We want you to exercise post-surgery. We want you to exercise after surgery. And we see many people that fall in love with the gym, that are able to do active things, and we want to encourage you. We want to be careful, though, not to beat up people who can't do that or who don't do that. I think that's where we want to be cautious. There are, again, this issue of blaming the victim. Okay, if you can get back to exercise, if we take a 150-pound backpack off your back, what do you think it's going to be like doing any physical exercise if you suddenly were to drop a backpack of 100 pounds? Okay, every exercise, everything you do is going to be better. Not only that, think of inside of you. Okay, let's wander around inside for a second. Let's look at your coronary arteries. Okay, if you're a normal North American male, your coronary arteries right now look like a pair of rotten pipes. They're not wide open and clean and smooth. They're ragged and narrowed. They're ready to kill you. If you're a middle-aged American male like me, slightly above middle-aged American male like me,
Fine middle age.
this is where you guys can chime in. Oh, Dr. Rutledge, you look so young. Okay, no takers on that. All right. But we think that right now, if you look around the room, those of us who are in the 40s and 50s, we can die. Any one of us right now, like Tim Russert, who was on TV, the NBC broadcaster, we can die right this minute, and the commonest cause is heart attack or stroke. Okay, we're looking at that because if we were to wander through our bodies right now, we would find narrowed, partially plugged pipes everywhere we looked. The first researcher who ever demonstrated how young that began was a researcher I worked with at the National Institutes of Health, Dr. Roberts, who did autopsies on some of the young men who were killed in Vietnam. And looking at their aortas, even at 19 years old, there started to be plaques of cholesterol in those young men, even at that young age. So you think about us, the guys sitting in here looking at each other across the room, we're all basically ticking time bombs filled with thick plugs of cholesterol, abnormal areas that's likely to take our lives. All right. A minute ago, we're talking about exercise. Now, I want you to go exercise, and I want you to remember you got this narrow, partially plugged coronary artery, artery to your brain, artery to your leg, artery to your kidneys. That's scary business. Now, the surgery not only takes off a 150-pound backpack, but it begins to open those arteries. It lowers your cholesterol, it lowers your triglycerides. It starts to smooth out and clean out those arteries. Not only that, but it improves your fitness because you don't have to carry that extra weight around. Your heart pumps slower. So if you were to measure the heart rate of my patients, they go down, just as if they were a runner. Their oxygen and breathing at night gets better. In other words, most of my patients, when they sleep at night, snore.
Well, how does that work? How do you, and let's say you don't exercise, how does that clean your arteries? How does...
Okay? Let's imagine, I'm going to simplify things because I don't want to just spend forever talking about it, but I'm going to simplify things to say that the rotting, thickening, plugging of your pipes is essentially too much fat. Cholesterol, triglycerides, there's inflammation involved, a lot of things. but I'm going to simplify it and say too much fat. And many years ago, one of the questions was, let's imagine that we lower your cholesterol. Is there a possibility we could reverse this, or can we just stop it? If we have narrowed arteries on a cardiac catheterization, can we ever clean them out? Can we ever open things up, or can we just stop it where it is? And so a diet doctor named Dean Ornish took 17 catheterization patients with narrow coronary arteries, and he put them on the Dean Ornish low-fat diet. Which, if you've never been on it, it's a pretty strict low-fat diet. I mean, you eat really nothing but cardboard and berries. It's a challenging diet. But it's a good one. It's very healthy, fresh fruits and vegetables and things like that. And a year later, he did catheterizations and cholesterol measurements on those patients' heart. And what they found was the arteries began to open. And their low cholesterols are not quite as low as the cholesterols that my patients get after the MGB. And the reason the cholesterol goes down so much is the bypass. The bypass bypasses where you digest and absorb fat. Remember? Okay? In other words, not only do you get dry skin, but that lower cholesterol, lower triglycerides, and lower C-reactive protein and inflammation, all these things begin to reverse these negative things that are part of the deadly process of obesity. It's so powerful that recent research suggests that if you look at the risk factors, you can predict the increased average length of life people get from the weight loss of the MGB. In other words, if you take somebody who's 39 years old and weighs 300 pounds and has diabetes and high blood pressure, you can, on insurance websites and other research websites, calculate how long you're going to live. Now, it's not accurate. It's an average. You could still step out in front of a bus, or maybe your grandfather lived forever or something like that, so those will change it. But if you put in your age and your weight and these other risk factors, do you smoke and all this stuff, then you can calculate how long you're going to live on average with pretty good accuracy. Then you can do an MGB on that same imaginary person. Take their weight down, keep the same age, and take away their blood pressure and their diabetes and sleep apnea and predict. And the average changes in these various studies is an additional 10 to 20 years of life.